Hi, I'm Joe Camp. I've been practicing endodontics in North Carolina for over 40 years and teaching part-time during my entire career. It's impossible to do good root canals without knowledge and understanding of root canal anatomy. Let's take just a couple of minutes to discuss some of the basics. Going back to 1925 from a study done by Hess and Zurcher, we can see with models that they made of the teeth that pulpal anatomy has unlimited variations. And pulpal anatomy affects their ability to completely debride and fill the canal system. And you must understand pulpal anatomy in order to perform root canal treatment. Conservative treatment in undeveloped roots must be rendered to allow root completion to give the strongest root possible to prevent future root fracture. Completion of root development simplifies the anatomy of the root canals. Many treatments are based upon the diagnosis of root development. And in order to diagnose root development, one must have a thorough knowledge of root formation. So let's look at the formation of the root canals in the human. If we look at these two upper premolars, we can see how roots form on teeth from this single canal at the cervical line. As the root development and length is increased, the sheath bridges over and fuses together. And once that happens, as illustrated by this tooth on the right, you see the division into two canals. Within each of these canals, you can then have the formation of more than one canal. And so that is how we get multiple canals within the roots. If we look at this illustration, again of two upper premolars, we see a tooth on the left which has three separate roots that were formed by Hertwig's epithelial root sheath, while the tooth on the right only has two roots that were formed by Hertwig's sheath, but within the facial or top canal that you see in this tooth, you can see there's going to be a division of this tooth into two canals. Thus, both of these teeth will wind up with three canals, while the formation was not the same in the two canals. And treatment's going to be different here in these teeth because of the way these teeth form. And getting into the canals, the tooth on the left will have three orifices, but the tooth on the right will only have two orifices within the pulp chamber, and you'll have to go down the root to get into the bifurcation of the two canals. In this schematic, we're illustrating with a primary lower molar the development of the mesial root of a mandibular molar. Now, the only difference between a permanent tooth and a primary tooth is the fact that once the primary tooth has completed its root length, it starts to resorb. And if you notice the difference at the apical ends of these three schematics, you will see that illustrated. And so that's a difference. The primary tooth never has an apical constriction, whereas a permanent tooth goes on and develops an apical constriction because you don't have the resorption going on. But on the left schematic, there's one canal, one root, one canal. If you look in the middle schematic, what has happened here is that because the root is narrower in the center, you've had a coming together of the mesial and distal aspect of the root, and this fuses, and then you start to grow islands of dentin. This happens in multiple places up and down the root, and this eventually, in most teeth, will go to the third schematic on the right, where you have a division into two separate canals. But in some teeth, we have these channels continue to exist across here, and they're called isthmuses. The problem is that in a conventional radiograph, we can't see those isthmuses. The other problem is that our instruments do not go in there. You can never get an instrument to go into those channels, and therefore we're dependent upon having good irrigation to try to wash out debris and bacteria that might be in those channels. So there's one other aspect of the development that you need to be aware of that creates problems for us. Because these roots are wider at the exterior and the canals thus are going to be wider, as you get this division, it leaves a projection going toward the center of the tooth like a pointed triangle, and that is called a fin. We cannot enlarge root canals enough to incorporate these fins. Therefore, we're dependent again on irrigation to remove the debris and bacteria that's in these areas. As you have just seen, there are a lot of variations with root canal anatomy. Knowing that these variations occur in the canals and that you're unable to completely debride the spaces with instruments necessitates significant use of irrigants to assist in cleansing. The bottom line is instrument shape and irrigants clean, and you need to follow this rule every time you do a root canal. I'm Joe Camp for Chair Time.